For children with Down syndrome, there are many factors that can affect their feeding development, including their health status and health history, their emotional state, their overall learning needs, and their temperament, especially their temperament around trying new things or being adventurous. We also need to consider their behaviors around feeding and around meal times, their oral motor skills, and their oral sensory processing skills as well. These factors are all related in development and can directly affect each other. For example, if a child has difficulty with sensory processing around a certain texture, a certain flavor, and they find it aversive or unpleasant, they're more likely to have negative behaviors around this experience. So let's look at these in a bit more detail. So a child's behavior includes anything that they do with food and during the meal times. We need to remember that difficult behaviors often begin as automatic responses to sensory or motor difficulties or communication difficulties, but of course can progress from there. For example, if a child is unable to communicate verbally that they're all done with something, they might use their behavior to throw the food or push the food away so that they don't need to eat it anymore. So they've used this behavior in place of a more functional communication strategy. Some of the oral motor skills we need to consider include things like chewing, swallowing, and all the self-feeding skills you can think of that helps the child get the food from the plate to their mouth. Our oral motor skills are influenced by our mouth shape and our body structures. So lots of children with Down syndrome have differences in how their mouth is formed. They might have a higher or narrower palate, more likely to have a smaller mouth, some differences in teeth eruption and dental health, and are more likely to have low muscle tone in the mouth that can affect their eating and chewing skills. We also need to consider their sensory processing skills. And remember that everybody has different sensory preferences and challenges. So a child's sensory preferences might include favorite flavors, and some challenges that they may present with include difficulty recognizing or tolerating certain textures or flavors. They may be more unpleasant to a child with Down syndrome than they would be to somebody who's otherwise has a more typical sensory processing system. And we need to be sensitive to that fact. When we're considering a child's learning needs and temperament around eating, we remember that all of these things include how our child responds to these different experiences and meal times, and know that how they're feeling at the moment, their emotional state can affect their willingness to try something new or try a new food. Also, their overall learning needs can affect how quickly they learn these new skills, and their comprehension can affect, and social comprehension can affect how they learn from other people at a mealtime. So we may need to make some things more clear or explain things in a different way than you might an otherwise typically developing child. Finally, their overall health status and health history, of course, has an influence over everything. So when a child is feeling unwell, this really affects their ability to handle new challenges, and they may miss out on certain learning opportunities. Some relevant things to consider in a person's health history include allergies to food or sensitivities to certain foods, and of course, any gastrointestinal issues such as constipation and reflux that can affect how well they digest food. Really, we need to keep in mind that any illness that affects a person's overall energy levels can really impact their eating as well, especially if it's not the easiest or most pleasant experience for them from a sensory perspective. So what we encourage all families to do is to think about their own child and try to think about these issues specifically. So what is your child's health history that might have impacted how well they're feeding? What are some of the factors in their learning needs and their overall temperament that you can consider when you're coming up with a new feeding plan? And then think specifically about what behaviors, what oral motor skills, or what oral processing issues you might want to work on in therapy.